Welcome, and thank you for tuning in to On the Go with CAO, a podcast by the Centers for Advanced Orthopaedics. Join us as our orthopedic specialists share their tips and advice for keeping you on the go and in the know, including the latest on how we're treating and caring for injuries and diseases of the body's bones, muscles, joints, ligaments, and tendons. We're here with over 60 offices in Virginia, Maryland, and DC to keep you active and on the go.
Hi, welcome to On the Go with CAO. My name is Harrison Solomon, and I am a hand and upper extremity surgeon at the Centers for Advanced Orthopaedics at our Chevy Chase location. And I'm very pleased to be here with Dr. Beatrice Grasu, another hand surgeon in the Centers for Advanced Orthopaedics.
Yes, and I'm with the Baltimore division through OrthoMaryland. Thank you for having me today.
Great. Well, we're so happy to be here to talk about hand and upper extremity surgery, something near and dear to our heart. But more than just surgery, which is a topic that comes up frequently. So, Beatrice, when someone asks you, what is hand surgery? What do I see you for? How do I know if I need an appointment with a hand and upper extremity surgeon? How do you answer that?
While we are surgeons, I would say that a minority of patients that come to our office are we actually operating on. And I really have just an open door policy that if there's anything concerning from the fingertip, the nail, the fingertip, all the way up to the shoulder for me, I am more than happy to evaluate people. And that can be something traumatic, whether it was a fall or a cut, and something more chronic like an arthritis condition. So we see tremendous variety as far as age groups go and conditions. And I would just say to anyone that asks me, if it's something with the arm, come and see me, and I'll be happy to check you out and figure out what's going on.
In hand surgery, we really do the upper extremity, shoulder to fingertip, and we take care of about half and half acute injuries versus chronic problems like arthritis, different forms of tendonitis, and various overuse injuries as well in the arm, which happens a lot. We're seeing shifts in where people work and how people work. And could you tell us a little something about how that has caused any sort of shift in your practice or the different problems that you see affecting the upper extremity?
I think that people are working from home a lot more. They may not have the same ergonomically friendly setup that they have at their office desk. They're having trouble putting away their work. I think people are working constantly. And so we've had this discussion before where it's important to take breaks, stretch out your fingers, just keep things limber, and just keep things kind of moving around so that you don't get stiff and you don't develop overuse, kind of these tendonitis conditions and problems like that.
Similarly, and I think when we have changed our work-life balance, things change, and frankly, there's more stressors out there. There's more anxiety. So I also recommend a lot to people. Some people will just show up with hand pain. It can be associated with their job. It can be associated with working from home. And they may have real live tendonitis like you're describing, or they may just have a poor setup and some different stressors, whether it goes to their arms, their neck, or their back, that can be alleviated with general health guidelines and principles such as eat healthy, take frequent breaks throughout the day, get outside, go for a walk. Yes, make sure your ergonomics are good so your screen is in front of your eyes and you're not looking up or looking down, or you're not hands high, hands low. And just general principles that can serve people well in that regard.
You should take breaks, maybe get one of those stress balls when we're focusing particularly on the hand, but of course being healthy with a well-balanced diet and getting exercise outside or just taking a break. I think that's very wise advice.
Yeah.
Other things that I'm seeing, especially this summer, people being outside and being active, bicycle accidents and things like that, obviously are just falls on outstretched wrists or fingers. So whether that's, oh, I sprained my knuckle or, oh, I broke my wrist, obviously those are things that we're very comfortable taking care of,
Sure.
getting x-ray in our office. And again, trying to maximize non-surgical treatment before we go on to consider surgery if necessary. So tell me, what are some common conditions that you're just seeing on a day-to-day basis?
Sure. Well, we see all kinds of conditions. About half of them are injury-related, half of them are more chronic. And moving down the arm, in the shoulder, we see a lot of rotator cuff problems. We see some shoulder arthritis. We see shoulder fractures. And then at the elbow, there's lots of tennis elbow and golfer's elbow, which is a tendon condition. And then also some injuries and some fractures. And this spans all ages. And we see kids with what's called a nursemaid's elbow. They get picked up, and if they're picked up by their arms just the wrong way, one of the bones in the elbow can shift out of position, and the child can't move their arm. It's partially dislocated, and they're a little inconsolable, and that's easy for us to take care of. But moving down the arm and the hand and wrist, what are common diagnoses you see down there for people to come in for?
Well, we've talked about this before, but the bicycles, especially in the spring, it seemed like people are excited with the nice weather. A lot of accidents, a lot of wrist fractures, whether, again, that's the cyclists that are a bit older or the kids that are just excited to get out on their bikes again. We see plenty of finger fractures, lots of bones that can be broken in this area. So obviously we're pretty thorough in our exam. And then just the overuse, arthritis at the base of the thumb is a really common complaint. People coming in and try to maximize, the topical gels for it or the cortisone injections, braces, things like that. And then we have the nerve, carpal tunnel, cubital tunnel, different nerve-related issues.
Right.
Yeah.
So, Dr. Grasu, depending upon the season, do you see what kinds of different injuries do you see, whether it's in the spring, summer, fall, or winter?
So winter is a big one for us as orthopedists in general, just with the ice and slipping and falling. With us covering the upper extremity, we see a lot more wrist fractures, especially when there's a bad winter. Last year we had so many snow days. And just when things start to get slick, unfortunately, people are falling down and injuring themselves. And then, of course, when we have real snow that people are excited to bring out their snow blowers, we will see some amputations or just some really significant soft tissue injuries, despite the machine being off and the machine coming with a stick that you should put in it. People use their hands. And so there you go. There's your PSA. Do not put your hand in the snowblower, even if it's turned off. Thank you.
Or the lawnmower.
Or
somehow. So we do see work-related injuries, table saw injuries. We've all seen plenty, and there are knots in the wood, and they'll catch the table saw, and the wood can jump and suck a finger in, and so those can be some of our more devastating injuries. Do you see ever July 4th injuries?
Yes, unfortunately, right? The fireworks in the hand and explosions. Seen some really nasty ones with kids, unfortunately. Now, being more in private practice, those injuries typically go to the hospitals. So I'm not seeing it as much, but plenty of burns. What about you? Are you still seeing a bunch?
Yeah, not as many. I was on call for 4th of July this year, and I did have a couple of fireworks injuries, and they were in kids. And the worst of them were homemade fireworks. So there's a lot going on out there. Keep an eye on your kids. They're all kids, mine included, are mischievous and curious. Really, it's healthy, but sometimes it can be dangerous. And yeah, you pointed out the ice. I think the broken wrists, while they're bad, especially in winter, That's a 4-season sport because it's so common.
Yeah, I had a string of them in the summer. It's not even icy outside. What's going on? But people manage to trip and catch the curb wrong or something like that. The spring, the gardeners are out, and although I'm not really sure when the rose bushes, is that in the spring or the fall? I'm not sure exactly when the roses come out, but thorns and just nasty infections sometimes in the gardeners.
Sure. We'll see. I've not a lot. I've seen 2 snake bites in the last year.
Mm-hmm.
Copperhead snake. Mm-hmm. Most of the snakes around here are not venomous, but they're around, and so they're not to be played with. And I think at the end of the day, what we're also saying is that these are normal people doing normal things. Mm-hmm. Whether it's a child, whether it's an adult, it's sometimes you could have been more careful, but most people are seeing us because they're just normal people doing normal things, and something unlucky happened, exactly, or some part got worn down. Mm-hmm. But again, that's just what we do and why we're here, and a lot of different ways you can develop an issue in your hand and arm, and we can help you take care of it.
Absolutely. Yep.
People, I'm sure, are hearing us and saying, great, I can come to them. Any problem, shoulder to fingertip, that's great. But doctors, how can we prevent, even though you seem like nice people, how can we prevent ourselves from having to come to the doctor's office?
Absolutely. I say, I hope nobody gets hurt. I hope I never meet you, but certainly if you do get hurt, I'm more than happy to help you. So prevention, you had mentioned cooking injury. So obviously good technique when you are slicing, cutting potatoes and things like that, just kind of tucking your fingers in and trying to avoid getting your fingers. You had mentioned when you're working and just kind of an overuse to take breaks. I'm a big proponent of running your hands under warm water if you're starting to develop any stiffness, just trying to keep them limber, a stress ball. What other thoughts do you have for prevention?
Yeah, very similar. I think we're at a real advantage because I catch myself during different days, whether it's in the kitchen cooking or just how I'm walking downstairs. Mm-hmm. I'm sure in the back of my mind, I remember a patient who got some sort of injury, and so we were able to keep those things in the back of our mind. But really, yeah, it's just overall healthy habits. Of course, non-smoking. Smoking is at the root of many orthopedic problems, which really is a surprise to a lot of people out there. They associate it with lung problems and heart disease, but our patients who smoke are really slow healers. Lots of times the bones won't heal, the soft tissues don't heal well, and higher rates of infection, and higher rates of carpal tunnel syndrome, and so many other different things. So no smoking, a very healthy diet, frequent
taking care
meals.
Of your sugars if you're diabetic. Yep.
Very much so. A lot of orthopedic manifestations of diabetes, and tight control of that is so important. And then, the frequent breaks and just overall healthy living, and be cautious. Mm-hmm. Lots of times our body deep down is telling us if we're doing something risky, like if we're holding an avocado pit and we're stabbing the knife into it like that, there's something in the back of your mind telling me that there's got to be a better way.
Yeah. I find myself, I have 2 small children, and so I am always watching. Do not put your fingers there. Where are the doors? How are the doors being shut? Don't catch your finger in there. Obviously, it's hard when you're running after them, but we see that a lot where accidentally fingers get slammed in doors.
Yeah, so overall, a lot of common sense things, but we're happy to discuss more with you, or if anything comes up, like we both, I think, echoed today. For hand, it's really hand and upper extremity. It's shoulder to fingertip. It's injuries. It's overuse. It's pain. Lots of times it's just pain of unknown cause, and that's why we're here, and we do this every day.
Yep, we take care of kids. We take care of more experienced patients. Just a wide range of ailments as well as age groups.
We hope you enjoyed this episode of On the Go with CAO and invite you to tune in next time. To learn more about our upcoming episodes or to check out our online library of previously broadcast episodes, please visit cfaortho.com/hub. That's /HUB. Or search for On the Go with CAO on your favorite podcast app. Want to help keep others healthy and on the go? Then please share this episode. At CAO, you'll find over 160 orthopedic specialists committed to providing patients with an exceptional standard of care. The information contained in the On the Go with CAO podcast is for informational purposes only. It is neither intended as rendering medical advice nor as a substitute for seeking professional medical assistance. No relationship between the Centers for Advanced Orthopaedics and its practitioners may be created through On the Go with CAO. Any individual with specific questions regarding his or her individual health or treatment options should contact the Centers for Advanced Orthopaedics and schedule an appointment with one of its practitioners.